So, we talked about temperature. So, 37 to 38 being the optimal temperature for wound healing. Right? If we let them cool down, we expose them, and that's when we're doing dressings, right? 3 to 4 hours to restore the healing temperature. So, that warm and moist is that important. 3 to 4 hours is a lot to restart the whole process, let alone it takes the time to reactivate everything in there.
So sorry, Ned, that means that you've got to keep the room...
Try and do your dressings as quickly as you can in a fairly room temperature room. Don't have a cold room to do it in.
Oh, okay.
A lot of people take them off into a treatment room, which is on the side. It's well air conditioned and fantastic. Doesn't help healing. And keep it warm, keep it moist. It's a pretty good principle. It's been around for a fair few years now.
So what's the evidence base that based that on? Evidence-based research and stuff. What have they based that on? That to keep it warm, keep it moist.
You would have to go and ask the wound care nurses.
Oh, okay.
That's where I got that from. But they have shown there was a huge study done, and it was done in tropical. They did it during I can't think of which one it is now. One of the little complex they had, and they discovered that people in tropical areas, as opposed to people in the colder areas, healed faster, and they based it on that's where they got the warm from. The keeping it moist, I'm not sure, but it will be something you could look up. But the wound care nurses always remind me of that. So wound dressings. There are 7 basic principles for selecting a wound dressing. We want to provide that nice, reasonably moist environment in most cases, right? Some of the little skin tags you can put a dry dressing over just to protect it, just protecting it. But they try to get a non-stick dry dressing over the top. Just trying to think of the name of it. Mepitel is one of them that they use. And it goes over the outside and protects it. Melanin, where it has a shiny and dull surface. The shiny surface is a non-stick surface.
What about those silk, like silk?
About to talk about those. Good. So we need to manage our excess exudate, so we might need something that soaks up the exudate. Allow for gaseous exchange, you know what we're talking about?
Flow, air.
Airflow.
Yeah.
Exactly, we still want to keep the airflow into it. If we cut it off, then we cut off the oxygen and we allow the non-oxygen requiring bacteria to grow rapidly.
Because there's a lot of dressings out there that are water resistant and stuff.
Yeah,
See them on the
so a lot of them have, what they have is a very fine, micro-fine thing that allows oxygen in and out, so it allows gas exchange. They seal over and they stop the exudate coming out, but there's still a bit of a gas exchange going on.
Oh, okay. Is that like that white, when you might have stitches and stuff?
No, that's normally melanin. That's a dry dressing. And that does allow
You can get it wet, like this stuff you could get wet, like that was...
You can get it wet, but it dries out. Yeah. That's a melanin, that's just a protective dressing. Depends on what they put underneath it. But melanin is just basically a protective, non-stick dressing. They want to keep your suture line dry, because what happens is you get a really damp suture line. It's one of those occasions where you need a dry dressing, is the stitches will all pull out.
Yeah, well that stuff's like sticky.
Yeah,
sticky,
and it's got sticky edges around the edge of it.
Oh, no, actually it's like tape, like you cut it.
Yeah.
And you put it on.
Stuff you're talking about. It stretches.
Oh, fix them on. They call it.
Yeah, and it's like a hot. So
it's like a gauze. It's sticky gauze. Yeah.
Keep it in place,
but it's very
gentle
gentle on the skin when they pull it off.
Yeah, and you just got to pull it the right way and it comes off. Yeah. One of the ways they get that off is they rub cottonseed oil on it and it peels it up.
They actually had these little tear out sachets.
Yeah, Zoff, they call that.
Yeah, rubbed it on there and then just lifted the glue. Yeah.
Cottonseed oil is one of the ones they use in nursing homes because it's gentler on the patient's skin.
Oh, okay.
So it needs to provide a constant wound interface. Isn't that interesting? A wound interface. So it needs to be up against the wound. So you don't want something sitting over the top of where everything can go in underneath. It needs to be over it and protect the wound. Protect the wound from pathogens, pathogenic organisms. So you mentioned the silver dressings before. That's one of the ones they use on burns. Because silver is one of those things that they put that over, they dampen it down, and it releases the silver into the wound, which silver is a proven antibiotic, and it kills off some of those really nasty external staph bugs on our skin.
Yeah, I've got dressings at home I use on my dad sometimes.
Yep, they're grey, yep.
Yeah.
And they've now got the self-moistening ones. You don't need to wet them anymore. I haven't seen them yet, but I was reading up on wound care, and it would look very impressive. You don't need to wet them, which is lovely. And emergency department where I used to work has just brought them in.
Yeah.
Because we used to put on the silver dressings and tell them to every 4 hours you have to get up and wet it, because they forget it.
But if I burnt myself at work really bad,
Yep.
and went and got that cream, the silver
Silverzine, yep.
yeah,
That's it.
and
They've gone away from it though.
yeah, but it's not a scar, there's nothing.
No.
And
Silverzine's good on very superficial wounds. The problem with the deeper 2nd degree, 3rd degree burns is that it's in a paste, and the problem is things like those pastes, even though there's silver in it, can still help build bugs, because it can go sort of like a bit off, if you want to put it that way.
Well, you can only use it for so many days, 5 days.
And then you have to clean it away. People forget to do it, so to grow bugs in it. So the silver dressings don't do that, because it's not a nice environment for it to grow in if it dries out.
You can buy silver band-aids too.
Yep, absolutely.
Yeah.
And we need to protect the wound from contamination from particulate matter. So, other bits of stuff. So, you protect your wound, so bits can't fall into your nice open wound. You're laying in hospital, you don't want the dust from the roof landing in there, or people coughing with a bit of saliva into your wound. Never a good thing.
Dropping my hair on it.
Yeah, hair, all those things that can go into it, they'll cause infection. And protect the wound from trauma. You don't want them bumping it again. So you might have to protect the wound, put it in a sling, get them to lay with it comfortably. Sometimes they put them on an arm board so they don't bump it or get more pressure onto the wound. So wound cleansing. Wounds that are healthy and free from debris do not require ritualistic cleaning. Right? If dead tissue or foreign debris, right, e.g. dust from the roof, hair, right, presenting wounds, they should be cleaned, as this matter may support the growth of, obviously, bugs. So, we don't ritualistically clean. We used to, once every shift, wipe that wound out. The problem is we're taking all that nice granulating, growing tissue away. So we are actually defeating the purpose. We're keeping it clean, but it wasn't healing. It was healing a lot slower because all that good tissue is getting wiped away. And they used to use gauze, which was rough, a bit abrasive. So we don't do that anymore. So if it's indicated, right, irrigation's the new trendy thing to do. Bit of the old saline with a syringe, gentle irrigation. We do not need to get there and go with a 50mm syringe and blast it. It is not a sandblasting exercise. We want to wash it away gently. So we're getting the particulate matter out, and again, we're not washing away all the good tissue. Okay, if there's stuff that's stuck there, squirting it madly will not help it. They need to debride it, so you need to get an expert in, the doctor or the wound care nurse. Alright? Because that's what we'll do, we'll break down this nice granulation and the epithelializing tissues. Took me a bit of work. I practiced that yesterday. So, again, physiological saline, normal saline, which is a isotonic solution.
It's the same salt level as your cells and your body.
Yep, absolutely. So we're not throwing salt water onto it because it won't sting because it's a nice open wound, but it'll wash it away. If it is a shallow one, we use salt that might sting a bit, so we can use ordinary water, right? Sterile water in a hospital. But there are a lot of people, a lot of wound care nurses, particularly home care wound care nurses, go tap water's just as effective.
Well, it's already had the bugs killed in it.
Yep, it's got chlorine in it.
Yeah.
It's got, a chlorine salt in it. Kills most of the bugs out of it. And they found that there's not a lot of difference between using tap water and saline. So, particularly leg ulcers, and it's cheaper for the client, right? But there's not a lot of difference. We do use the sterile water because it's convenient in hospitals, and you don't want to be going to the sink and filling up because you don't know who's washed their hands in there. So that's why we tend to use the sterile water in hospitals. One would hope that you know what's been in your sink at home most of the time. Tank water can be an exception though. They're careful about tank water. Depends if they have the ultraviolet filters on them and all that sort of thing. Because you can get some bugs that grow in tank water from the dead possum and that sort of thing. I know it adds flavour, but it's not necessarily good for your wound. Studies indicate that saline and water should be warm to body temperature. Remember what we said about cooling it off?
Yes.
Now 37 to 38. Otherwise it slows down that cellular repair, it makes your wound cold. And it's not very nice for the person if you squirt a nice bit of icy water into a wound where there's nice exposed nerves. I'd strike out.
Basically use a tempered water.
Yep, hold it in your hand and warm it up to your body temperature. So, instigate general infection control procedures with wounds. Common sense, hand washing, the ultimate thing for everything. And I always say when I do wound care, I always wash my hands in front of the patient. I like them to see that I'm washing my hands. And they're becoming more and more aware today about saying, if you washed your hands, don't be offended by it. In a lot of hospitals there's big signs. There is nothing wrong with asking your nurse or your doctor if they've washed their hands.
Because some of them don't.
Some of them don't, nurses and doctors. Plastic aprons, because you don't want pus down the front of you all day. Gloves, because that's common sense. And goggles, because you don't want it in your eyes. Okay, dressings. There are different types of dressings, right? So there's the dry dressing. We mentioned melanin. It's one of those ones you put over surgical wounds because you don't want to get macerated edges from the sutures, right? You put that over it, it keeps it dry until it starts to heal, and they remove the sutures. Then they tend to decide if it's going to be an oozy wound or not, depending on the size, nature, the type of suture they use. They'll keep a dry dressing, or they'll go to a slightly moistened dressing to keep it going. Hydrocolloids. Who wants to go for hydrocolloid?
Would be something to do with water.
Yeah,
Colloidal silver.
Hydrocolloids.
Yeah.
Colloidal. Hydrocolloids are things like a saline-based dressing, packs. And you'll pack them out. So they're a wet dressing. Foams. What do you think we'd use a foam dressing for?
If they're going to line it.
Yep, padding.
Padding.
It also, if you've got a lot of exudate, it'll suck it up into the foam, and it'll keep the exudate out of the wound, sucks it up into the foam cells, so it doesn't go back onto the wound. Alginates, seaweed dressings. That's where our alginates come from. They have healing properties. And they also, certain wounds, they help also suck up the slough and stuff. But they do have natural healing properties in them. Hydroactive. For the heavy exudating, so hydro, they actively suck up the water.
They put it on a pump. That's one of those vacuum.
The back dressing.
Pressure
dressings. You also have some of the hydroactive foam ones as well, are hydroactive. Hydrogels. They're a water-based gel, normally a saline-based gel. One of the common ones is Solugel. They pull it in the wound because it helps the granulating tissue grow. It's a nice, moist environment and it grows into it. That's for deep burrowing wounds they do that. Pack it with hydrogel. As opposed to the gauze, problem with packing gauze in certain wounds is you pack it in, it dries out, and then you pull it out. So it takes all your granulating tissue with you. So to get it to grow, they pack it with a hydrogel. And sometimes I'll put the gauze in there as well. And that way it keeps it nice and moist so you're not ripping all that good stuff out with it. Packing gauzes are not designed as a healing thing. It's actually to help stop the wound healing in a certain way. So they'll put in a gauze wick. You've got a nice burrowing wound. You put your gauze in and you leave a little bit out so you can pull it out. So it stops it closing over the top and leaving a hole underneath it where it can grow in a nice dark, moist environment and grow nice bugs. So the gauze is to actually keep the wound open so we can get our air into our wound, our oxygen, keep the light in, keep being able to pack it, keep the good bugs in.
Sorry, they had a roll of
Yep.
gauze.
Gauze tape, yep.
No, just packing gauze.
Yeah.
It had some sort of fluid got
Yep.
cream on it.
Yeah, that's one of the gel type gauzes. That's one of the things they
So
use.
that's a gel one.
And there's one that you can get which is antibacterial as well.
Yeah, I don't know whether they cut a bit. I can't remember
Yeah.
if she cut a bit off. There's a few different
Yeah,
ones.
you
but
can
this
cut
one-
them off, wind them up, pack them into the wound.
Yeah, but they're all moist.
Yeah, they're a moist, yeah. They're normally they've either got an antibiotic or they stop that drying out and pulling out the granulating tissue.
Yeah.
That's why that moist process is important. Depends on what you're trying to do with the wound. There's our references, lots of them. Does anybody have any questions?
Are there any good books on wound care that, because we've got the assignment, what sort of, can you recommend any reading material?
Let me go back one. Which is the one I liked. I'm just trying, my little brain's got to go. There's some really good websites out there, and I thought I put it on there. The Australian Wound Care Management Association have lots and lots and lots of information on their website. I got a lot of my information from them. If I missed the A out.
Yeah, that's okay.
Oops.
We know.
Australian.
We pronounce it Australian.
Yeah. Australian.
Australian.
They are really good because they're the people that bring out the courses on wound care as well. But I did a little bit on that contamination infection to get that green and things like that in it. Let's look at the other one I liked a lot.
Wound West Education, taking wounds on ways to
Yeah, that's again not a bad one, but that's a journal article, journal. But if you stick to them, there are some good wound care books out there. If you're really interested, they can be quite expensive. But they recommend certain books. And as I say, they're in Australia, they're associated with the American one and the European ones. And they all get together and have big wound care conferences. And have a look at, go on, use YouTube, because there's some really good, YouTube video around it, and VEA have some great information on wound care, different types of dressings, all sorts of things.
So what does VEA stand for?
Everyone keeps asking me and I've absolutely forgotten.
What is it? V?
VEA. I said it yesterday.
Is that the YouTube thing?
Yeah, something association, and no,
That's right. Just,
it eludes me.
just put it. I don't know.
No, I thought I had it, but no. It's on the tip of my tongue. It'll come to me tonight about 2 a.m. Okay.
Yeah. The more you try to think about it, the harder it is.
But have a look on YouTube. Really good information. But as I say, they're the best people that I've found so far, and they're always current. They keep up to date pretty well. Any other questions? Inspiring comments?
That was well done.
Thank you. I appreciate that. But if you've got anything, if you find something interesting for your fellow students, please send it to your educator and get them to post it up on the resources folders. Because sometimes you'll find something that's really good, and I'm going to send them the YouTube link for that out to the educators because I found that really useful, and it's a good, basic, simple explanation of wound care. Okay, thank you guys. I appreciate you coming along.
Thank you, Neville.
Did